I want to take a minute and just thank everyone for joining us here tonight, and for those who may be watching us later on the internet somewhere, sometime, and someplace. I'm officially Reverend Dr. Kevin McBride, which sounds fancier than it really is, but my main job is I'm pastor here at Raymond Baptist Church in Raymond, New Hampshire. And I'm pleased to be able to be here with Dr. Ben Chan, our state epidemiologist here in the state of New Hampshire. And sort of our long title for tonight is, what is helpful for adult caregivers of children to know regarding children, vaccines, current state of pandemic, and especially for people of faith and how that fits with us. And I will say for anybody who's watching, this is setting in a church setting. We're not hiding that, because part of our conversation tonight is really geared for people in the Christian community, the church community. Hopefully it spills over to other faith communities to help understand and help bridge sometimes what is a great chasm between understanding of faith and science. Just a little full disclosure, my background, I started off as an aerospace engineer. I got my degree from Boston University. And science has always been a part of my background and one of my loves and my disciplines. And for me, faith and science have never been competitors with each other. But for me, they both have always worked hand in hand in seeing what God's doing and helping to explain to us what God's doing. And we're people of Scripture, of truth, but also science helps us to understand and reveal what God is doing in the world around us. So this is a great evening and conversation. Last spring, I reached out to Dr. Chan, seems like a long time ago, to see if we begin to foster a conversation, especially for those in the Christian community, to help answer some of the questions I was hearing within our own church community and other church communities as well about how this all works together. And over the last number of months, we've came to this evening of conversation, and hopefully it clarifies some of those questions for us. And again, hopefully it's helpful not just for us, but others who may be listening as well. So, this is not a scripted evening. If you're watching, there are no plants in the audience. There are no prepackaged questions. This is just honest question and answer conversations. It's not a press conference. It's not a report, but it really is just some conversations with all of us as friends, hopefully, in this setting. So I do have a few opening questions for us to sort of get us going and get us kicked off with this. But outside of that, it will be just questions from people who are here. And at the end of this video, there will be a website we'll direct you to. Again, if you have further questions, we'll direct you back to the Department of Health and Human Services website for information about COVID and vaccines and all that for any other questions you may have. So.
And actually, before you jump
into
your
ahead.
first questions,
because
this is not a scripted session, let me just say thank you for organizing this event and inviting me here to have this discussion. And again, it's meant to be more of I think, an informal conversational setting to address questions and concerns. This is not the type of setting that I'm used to speaking to from my, stance as a physician and as a scientist, but watching a lot of what's played out over the last year and a half at a national level, and just the divisive discourse that's gone on, I felt more and more compelled to, I think, try and address questions and concerns that we're hearing about from a standpoint, not only from science, but also from a personal standpoint, from my own faith and my own experience over the last multiple years. So I want to thank you for organizing this. And actually, even before you reached out and invited me to do this, I saw the news clip that you did back in January on WMUR getting vaccinated and promoting, the COVID-19 vaccine. And actually, I almost reached out to you at that point to thank you for some of the messaging you did around that. And I didn't at the time, but when you emailed and when you reached out, I recognized your name, and so engaged you in that conversation, and was happy to try and find a way to come out here and, at, I think, an appropriate time and have this discussion. So thank you.
I appreciate that, and I'm sure you had nothing else to do last winter besides trying to find me and track me down. So, but yeah, I appreciate that. So again, for people who may just know you from the press conference behind the podium, standing next to the governor, standing next to the rest of your staff, and other people who are on the news, just a little bit. Let us know who you are. I mean, are you a New Hampshire native? I mean, how long have you been here?
Yeah, so I was actually born in Boston, Massachusetts, but grew up in New Hampshire. So
Okay, now you can hold that one down.
went through the entire Concord school district system from elementary school up through high school. Graduated from Concord High School, and then went out to Wheaton College in Wheaton, Illinois, for 4 years. Spent an extra year out there working afterwards. And then got tired of the Midwest because I'm from New Hampshire. I miss the mountains. I miss the New England area. And so came back to New England for medical school. I went to actually the University of Vermont, sort of up the road. Was there for 4 years. And at the end of medical school, I've been in New Hampshire ever since. I've done further training at Dartmouth-Hitchcock Medical Center in the Upper Valley, which is where my family and I reside now. Did my internal medicine residency up there. I worked for a brief period of time as a hospitalist up at the hospital, then went back and got an infectious disease fellowship, got an MPH degree. All that was at Dartmouth-Hitchcock Medical Center and Dartmouth College. And after training, took a full-time job in public health in Concord. So my family and I still live in the Upper Valley. We love the area, we love the state, and we've been here back in the state since 2007.
So, briefly, you're one of us. You're not somebody from out there who's sort of come in. You live, breathe, and you understand New Hampshire.
Yeah,
that's great.
I'd say so.
So you just sort of gave a little bit of your science background, and that's great. And I just want to ask, was there a moment in sophomore year in college, sitting in organic chemistry, where you said, "Man, I just can't wait to get my hands on a pandemic. This would be the best thing I can do in my life"?
That's an interesting question. I think when you're in organic chemistry, you're focused on organic chemistry. For those who ever took organic chemistry in college, it's not necessarily an easy course. But no, I think I have always had an interest in science. And that developed through high school into college. In college, it developed into an interest more in the human medicine side of things, so like biochemistry, human physiology, which sort of led into my interest in medicine. But I've always had an interest in science. I remember, though, getting to a point in college and deciding what my career was going to be. Was I going to go into medicine? I was actually interested in college in pursuing public health, potentially full-time. And so there was this point where I was trying to make this decision: do I go into medicine? Do I go into public health? And ultimately decided to go into the medicine route, knowing that there could always be a chance to get more into public health through medicine, but the medical school, medical training was a longer route to do that. And so when the opportunity arose after medical training to work full-time in public health, I jumped on it because I had an interest not only in human medicine but also in population health. How do we address health issues at a state or a population level?
Okay. For people who don't know, and sometimes this has been a subtext message sometimes over the last year and a half, can you just talk for a minute about the relationship between your office, New Hampshire's State Epidemiologist, and how that relates to the government of New Hampshire?
That's a great question. And actually, when I'm talking to people about public health, oftentimes I start out with an org chart, which doesn't sound very exciting, but really to understand government structure and public health, it's helpful to sort of understand what an organizational chart looks like. But public health is an agency that's part of a larger governmental structure, right? The Division of Public Health Services, where I work, is one division within the larger Department of Health and Human Services, which is run by Commissioner Shibanette, who you see at all the press conferences as well. And ultimately, public health and the Department of Health and Human Services sits under the executive branch of government. And so I think one thing that's helpful to understand as we look at the response to the pandemic playing out is that public health is one entity that is trying to address issues that arise during the pandemic, public health issues, individual health issues, but there are multiple other players that are involved in having to respond to the pandemic and make decisions. So public health is one part of the larger Department of Health and Human Services in New Hampshire, and the Department of Health and Human Services ultimately works very closely and reports to the executive branch of government, that being the governor. And so when you see these press conferences, you have Commissioner Shivanette up there, who's the commissioner of DHHS in New Hampshire, and then frequently myself, Dr. Daly, others from the team occasionally also.
Appreciate your background and just your knowledge and your experience with all you've been doing. And it's, again, people like you are well needed in the last 18 months, but over in the normal course of human events anyway, we need people with that sort of background who we can trust, who know what they're doing. Being this is the conversation here in the church too, I want to talk a little bit about the faith side of it too. And for me, again, with some of my background over the years, I've seen too many times in church circles where faith and science are sort of put up as competitors against each other, and you either have to be pro one and con the other, or pro, they sort of, in competition with each other. And yet some of the greatest scientists in history have been people of Christian faith, and that has influenced their work and their background. So just talk a little bit about your own faith background, your own faith journey.
So I am a person of faith. I'm a Christian. I became a Christian as a child, and I grew up in the Protestant church. From a very young age up through when I graduated from high school, I attended the same church in Concord, what was then known as First Baptist Church of Concord, New Hampshire. The pastor at the time was Walter Holder, who has since unfortunately passed away.
Wally
Holder, yep. That the church has since been, I think, renamed Centerpoint Church. That's not the church I currently go to. My current home church is up in the Hanover area, what's called Christ Redeemer Church, or CRC, led by Pastor Don Williman. I think this discussion of faith versus science and how some people make it to be one or the other is a false narrative, right? It's faith informs science, science should inform faith. And I think it's important that people look at both aspects of this.
I was at a faith and science conference a couple years ago, and I think one of the best quotes I heard was from a scientist who said, "Each discipline should speak to its strengths and be humble in its weaknesses." And I think this speaks a lot about how we approach anything. We speak to what we know, and we're humble that we don't have all the answers, and that there might be other answers around too. But thank you. All right, why don't we pivot now to some of the points for the evening. And again, we'll get to your questions in a minute. We're here taping in early October. Schools have started. Family schedules are in place for the fall. Can you just give us a quick update as to current conditions as of Wednesday, October 13th? I know they're changing. Regarding COVID virus, its impact on our communities, schools, vaccination status in the state, and any trends you are seeing, especially with children right now.
Yeah, so we're very much in the midst of a pandemic still. I've heard people, some people say, well, the pandemic's over. That's not true, right? I mean, we're still seeing multiple peaks and spikes and surges in the COVID-19 pandemic. Community transmission, what we sometimes refer to as community transmission, how much COVID is in the community, still remains high across the state and across most areas of the country, in fact. And we track this in a number of ways. We track this by the number of infections that are occurring. We track this by some of the test data. We look at hospitalizations. We look at deaths. All of those numbers remain high or elevated in all parts of New Hampshire. So, partly what has been driving this is the Delta variant, the variant of the COVID-19 virus that emerged, at least in the New England area over the summer, and has been shown to be substantially more infectious or easily spread compared to earlier variants of the virus, and that really has fueled transmission within our communities. There's been increasing COVID in all age groups, but some of the more pronounced increases have been in children, those under the age of 20, largely because that's a highly unvaccinated population. And so, whereas in the very early stages of the pandemic, a lot of the outbreaks we were seeing, a lot of the morbidity and mortality of disease, so severe infections, deaths were in the elderly population in long-term care facilities. The impact on those populations is way down, which is largely due, we believe, to the effective vaccines. But we only have COVID-19 vaccines now that are authorized for use in people 12 and up, and even those that are in the teenage or young adult range, the rates of vaccination are lower, and then people under the age of 12 are not yet eligible to be vaccinated. So because of the lower rates of vaccination, we're seeing more COVID in the younger age groups than we saw at any point during the pandemic. And that's partly why we're sort of really looking forward to what's coming potentially in the next month around vaccines opening up for younger children, and continuing to promote vaccination as the primary way to control this virus long term. And by the way, the goal here is not to eliminate COVID. The goal is not to totally suppress infection. That's not the goal. That's not likely to ever happen. So we're going to have COVID circulating, but when you have a pandemic virus that is still spreading through a population and you have many susceptible people who haven't yet had the chance to be vaccinated, that causes a population health issue that needs to be addressed.
And how does it affect you? I'll go back to the faith side of it too. As a follower of Christ, when you see people suffering like that, in conditions like that, how does it affect you? What goes through your mind?
So, deep question. I think there's been a lot of frustration on both sides throughout the pandemic. People having different ideas about how to control this virus, how to stop the spread, whether it's even important to control the spread of this novel coronavirus. And I think one of the initial emotions I have is always frustration, right? Why don't people? Why is there not more concern for people in our communities, right? The public health perspective is one of, let's protect people in our communities, right? Let's look out for the health of one another. Let's address population health issues together. Public health is a very sort of collaborative sport. We can't enact public health measures on our own. We need our partners in the community. We need the public. We need our healthcare providers. We need our schools and businesses to buy into the importance of controlling this pandemic and the steps that we know work to protect oneself and to stop spread of the virus. And so there's always some amount of frustration there when people shrug off the importance of some of those measures or minimize the impact of COVID-19 when we're looking at people being hospitalized on a daily basis. I mean, there's 140 people hospitalized across the state with COVID-19. There's people dying from COVID-19. The majority of whom are not in long-term care facilities. People in long-term care facilities are highly vaccinated. Most of these deaths are now occurring in the community amongst people who are unvaccinated. And so, there's a need to do more to protect people in our community. And I'm rambling a little bit, so feel free to redirect me.
No, because I guess I'll put my hat on for a minute as pastor. I guess I would affirm and agree with some of that. For me, as a follower of Christ, one of the biblical mandates I see over and over again through Scripture, and especially looking at the life of Jesus, is the sacrificial giving of oneself for the benefit of another. And more the frustration, the sadness I see when I don't see people willing or understanding or comprehending the depth of what that looks like on a daily practical basis. I look at other parts of the world, and sacrificial giving of oneself means I give up my food today so you can eat today. That's sacrificial lifestyle. Unfortunately, I don't think it's something that's part of our Western church, Western culture DNA, that we're willing to sacrifice until I'm affected.
And this is where I think the goals of public health and the action that should flow from one's faith should, in my mind, ideally align, right? I mean, the first and greatest commandment, love the Lord your God. Second, love your neighbor as yourself. And the question is, what does that look like to love your neighbor? From my perspective, right, it's looking out for their health and well-being. And in the midst of a pandemic, I think we all need to more and more be asking that question, not only how do I protect my own health and my own interests, how do I protect the health and the well-being of people around me, my neighbor, my family, my community. And so actually, I think this is where sort of faith and science, align, where, we have the tools and we know how to, in the midst of a pandemic, protect oneself, protect one's community, minimize spread of this virus. And what's the motivating factor? Well, for myself, my faith, right?
And that's not a bad common goal to have, the elimination of suffering, but should be one that we can all agree upon. So,
and that's part of the frustration, because not everybody necessarily comes at this from the same perspective. And I think part of the divisiveness that we see taking place nationally and even locally in New Hampshire, I think it highlights a need to do more listening and understanding of different people's perspectives. And we're not all going to agree, but I think people generally need to be more open to hearing the concerns and questions that people have. And that's part of the reason I wanted to make myself available here tonight, is to hear what kind of questions, concerns people have.
Thank you. Well, we've been sort of rambling with each other, and I think it's a good rambling so far. So we'll give some time for some questions out for the folks that were here. And again, some ground rules as we start. Please come up, use the mic. You can take your mask off when you get to the mic. One follow-up question while you're here until we've had a chance to ask some other questions. I've got some other questions to fill in some time if we need to. And again, we're here tonight not to debate information, but really just to seek answers and clarity for questions that we do have. So if anybody would like to start us off, you can come on up to the mic and ask your question.
And it can be any kind of question, a basic question, a science question. You can ask me a personal question. It can be controversial, whatever.
Hi, Ben.
Oh, hey.
I'm a little nervous, so give me a minute.
Okay.
So my question is really about the vaccination. You said a few phrases that caught my attention, and then I have a question that's written down, so I'm going to try to ball it all in one. So you talked about minimizing the spread, and I know that you're referring to the vaccine with that. And this is my question. I realize that COVID symptoms should be less or not at all due to the vaccine, or maybe not getting COVID at all due to the vaccine. Is it true that people who are vaccinated can spread COVID? Why have different mask requirements for the vaccinated and unvaccinated if it doesn't stop them from spreading it? And does being vaccinated reduce the timeline for being contagious? So it's a big vaccine question.
Yeah, no, great questions. Let me pause there and think about where to start with that. So you're right. When I talk about controlling the spread of COVID, largely we talk about vaccines, but it's not just vaccines. We also talk about, we still talk, a year and a half into this, physical distancing and face mask use, which I think feeds into your second question. So yes, the vaccine is effective at preventing someone from being infected. The vaccine, if somebody does get infected, can minimize the type of symptoms someone has, can minimize the duration somebody might have those symptoms, and it can minimize the duration or the length of time that somebody is shedding virus from their mouth, from their nose, into the environment to other people. And so the vaccine becomes important on multiple fronts. One is to protect oneself from getting infected in the first place. One is to protect oneself from severe disease, being hospitalized, dying from COVID-19, if they do, by chance, become infected, because no vaccine is 100%. But then the vaccine is also important for protecting others by minimizing the amount of virus that's being spread into the environment. In fact, there was a study that just came out looking at what we call secondary attack rates in homes. So so this is me bringing science to the discussion, if that's okay, where they looked at the number of people vaccinated in the home, and if COVID-19 was introduced by somebody who was unvaccinated, what was the likelihood that somebody else in the home who was unvaccinated would also come down with COVID? And what they found was that the more people that were vaccinated, the lower risk that somebody else in the home would get COVID-19 if they were exposed to this person. Right, and that sort of, I think intuitively makes sense, because if you're protecting yourself from infection, and if you're minimizing the amount of virus that you're putting into the environment if you do become infected, then you're minimizing the risk to other people. And so there's science that has demonstrated this, multiple studies that have demonstrated this, but you're right that no vaccine is 100%, right? And so that leads to your question about mask use. And you asked, why do we have different recommendations for people that are unvaccinated versus people who are vaccinated, if somebody who is fully vaccinated can still pick up the virus and spread it to other people? And that's an interesting question, and I think that the fact that you asked that sort of highlights the fact that we haven't done a very good job communicating what our recommendations are. Because in fact, we do recommend that even people that are fully vaccinated, when levels of community transmission are high, wear masks indoors. So our recommendations for masking, and the CDC more recently aligned with this as well, our recommendations for masking is for everybody in indoor locations when there's high levels of COVID-19 in the community, for the exact reason that I think you pointed out. I think the messaging around this has gotten a little muddled and a little bit lost, but if you think back to April, I want to say, of this past year, when the CDC changed their recommendations for mask use so that they only recommended masks for people who were unvaccinated. At that time, we were still, even at press conferences, and we put out formal guidance around this, recommending that everybody wear masks, vaccinated or unvaccinated, to more quickly bring the levels of COVID-19 down. And then over the summer, at least the beginning part of the summer, when COVID-19 levels were low, we recommended that everybody could feel more free to take masks off. So we really have tried to look at mask use at a population level for everybody, so that when levels are high, everybody's recommended to wear masks. When levels are low, people can start to take masks off. And we actually saw this in the school system. So summer schools that operated, we said that schools could choose to pull masks off of students because levels were so low. And in fact, I don't think we saw any outbreaks. I'm trying to think if there was even one or two outbreaks in summer school over the summer when levels were low, masks were coming off. But as levels started to go back up, end of summer into the fall, we were more heavily recommending the importance of masks, particularly in schools where you have a largely unvaccinated population. But that's a long, rambling answer to say that vaccines are effective, but they're not 100% effective, and so when risk is high from substantial amounts of COVID in the community, we do recommend masks for everybody for the exact reason that you point out. You had a third question. I don't know if I answered that.
Has to do with when you can infect somebody else, vaccinated versus unvaccinated.
Yeah, so if somebody is infected with COVID-19, so just a terminology point here, COVID-19 is the disease. The virus that causes COVID-19 is SARS-CoV-2. So sometimes we talk about the COVID-19 virus or SARS-CoV-2, which is the virus that causes COVID-19. If somebody's infected with the SARS-CoV-2 virus, even if they're fully vaccinated, they still need to isolate at home, right? They're still infectious to other people, so they still need to stay out of public locations. And the isolation period is the same for whether somebody's vaccinated or unvaccinated, right? It's at least 10 days. So if you get infected with COVID-19, it's at least 10 days of staying at home, being isolated so you're not out in public places infecting other people. But I think it is important to note that there are studies showing that people who are vaccinated have faster declines in the level of virus that they're putting out into their environment. So it's certainly possible that even though they're required to isolate for the same period of time, 10 days, that they're going to become less infectious more quickly over time if somebody's fully vaccinated, if that makes sense.
But it's still the 10 days.
It's still the 10 days, though. Yep.
I want to ask sort of a follow-up question
Yeah.
to that, too. Thanks, Beth. You talked about masks anyway, and someone had asked, that texted me this, said if our school has a mask optional policy and our children are the only one wearing masks, is it worth for them to wear the mask, and does it really offer any meaningful protection at that point?
That's a great question. I mean, masks are most effective when everybody wears them, which is part of the frustration that a lot of people have had in the communities, and particularly in schools. I would argue that yes, that there is still a protective role for the individual wearing the mask. Right? Remember, we recommend masks for two reasons. One is to protect the person wearing the mask, right? The mask is effective at filtering droplets that you're breathing in, filtering them out. The other purpose of wearing a mask is to protect people around you, and this gets back to our earlier discussion about looking out for the health and the well-being of people around you. And part of the frustration from a public health perspective of people not understanding or maybe agreeing with that perspective, or people disagree on how to do that perhaps, but we recommend masks partly to protect the other people around you. The CDC has estimated and modeled that 50 to 60% of infections that occur are spread from people who are not having symptoms at the time that they're spreading their infection, right? 50 to 60% of people. That's one of the things that has made this such a difficult virus to control. And that's partly why masks over the course of this pandemic have taken a more and more prominent role, is as we have realized the level of asymptomatic transmission, the level, the high proportion of people that are spreading the virus to other people before they have symptoms, necessitates everybody taking steps, even if they're not having symptoms. And so mask wearing protects oneself, filters the air you're breathing in, but it also helps prevent the person from wearing the mask dispersing the respiratory drops out into the environment to other people. It helps to catch the respiratory drops that are coming out of, for example, my mouth right now as I'm speaking, or if I'm singing, or shouting, right? Yes, I would say the face mask is important to protect the individual, but face masks are going to be even more effective if everybody around you is wearing them, because not only are you protecting yourself by wearing it, but you're also protecting other people and preventing respiratory droplets from spreading into the environment.
But just as a visual, and I'm just kidding, but in our situation like this, relatively okay?
Yes, I mean, I'm vaccinated. I know you're vaccinated. I saw it on WMUR. So with each layer of protection, layer of prevention, the risk goes down, right? There's almost no scenario where there's going to be zero risk, right? So could somebody in the audience have COVID-19 and let out a big cough and spread some respiratory droplets into the air, and there's an airflow that wafts? There's always going to be some risk, and I think we need to get to a point as a society where we're accepting of some amount of risk. But there are steps we can very easily take now to protect oneself and protect one another, right? Vaccination, the first and most important thing that people can do to protect themselves, and as I was mentioning, protect other people. But, we're spaced more than 6 feet apart, so any, large respiratory droplets coming out of my mouth or falling to the ground before they reach you. We were wearing masks coming in.
Yeah.
It's a big auditorium, and so, we're not in a really close confined space. It looks like a newer building, so I assume that maybe the ventilation here is better than an old school building. That there are some difficult situations there. So, I think that there are, when you start piling on these multiple layers of prevention, it becomes safe.
Okay. And I know one of the things we did here early on was increase ventilation, HEPA filters on all the HVAC systems, and UV lighting throughout the whole HVAC system too. Again, just trying to do the most we
safer already.
Yeah. Oh, good. But just like you said, simple things, but things you can do to help that along. So, somebody else?
Hi, Kevin. If I can ask a follow-up question to your question, the one that you just read came from my husband, who unfortunately has another meeting tonight. So let's suppose that unvaccinated children in a school setting where masks are optional. Let's say that the child might have pre-existing conditions. In that situation, would a pediatric N95 or even double masking be a safer option? And then my own question is, hopefully pediatric vaccines are just around the corner. If one has a child who is going to turn 12 soon, is one better off waiting until the child is 12 and getting the adult vaccine, even if it may be a couple months out, or is one better just getting the pediatric vaccine as soon as possible?
Yeah, great question. Let me answer your mask question first while we're on this topic. If an N95 or a KN95 mask is available and your child is comfortable wearing it, then you could certainly make that choice. The material that's used in an N95 mask or a KN95 mask does have higher filtration. But generally, we're not recommending, KN95 or N95 masks for the public. Partly, you get the better filtration of these, what we call respirator masks, because of not only the material that they're made out of, but the seal that's formed around the nose and the mouth. And so, in the healthcare setting, healthcare providers are actually required to be fit tested for these kind of masks. To find the correct sized mask that forms a seal around the nose and the mouth so that air is not getting in around it. It's being filtered through the mask. And they do this in the healthcare setting in a variety of ways. They have this saccharin solution that they spray, and if you can taste it, it means it's coming in around the edges and that mask doesn't fit very well. Right? So there's limitations to using these kind of masks in the public setting because they're not fit tested. Right, and so air can still leak in around the edges. On top of that, honestly, it's harder to breathe in these kind of masks. And well, you're nodding as I'm talking about this, So I sort of got that impression also. If you've worn an N95 mask in a patient room, you go in a patient room and you talk for 10 minutes, 15 minutes in an N95 mask, and you get out of breath. Right, like these kind of masks are really, when they're properly fitted, are really intended to be worn for shorter periods of time. And when you're talking about putting them on a kid, compliance, I think it's going to be really difficult to have a kid be compliant with wearing an N95 mask throughout a school day. Like you could choose to do that. I don't think there's anything wrong with making that choice, but in general, we have not been recommending N95 masks for people in public because they're just harder to breathe through and much more uncomfortable. Some people don't have any problems, and if that's the case, then you could choose to wear it if you have access to them. What is important, though, and typically we would point to people to information on the CDC website around how to get a better fitting mask. Right? What we found, and there are some kids that complain about, the comfort level breathing through a cloth face mask. And what I found actually is that the over-the-counter surgical masks are actually easier to breathe through sometimes than cloth, homemade cloth face masks. So if somebody's looking to upgrade their mask and they want a mask that's easier to breathe through, typically we recommend trying out like what you're wearing, like an over-the-counter surgical mask. The material that's in there tends to be easier to breathe through and also typically has multiple layers, 3 layers or more, provides better filtration. And on top of that, a lot of them have, you know, the wire you can pinch over the nose. And if you look on the CDC website, there's other recommendations for how to get a better fit of the face mask. I think it's more important to have those multiple layers, have the bridge that will pinch over the nose, and then make sure that the mask is fit as best you can around the nose and around the chin and the cheeks. So that tends to be my recommendation. We don't typically recommend these N95 masks for the public, but certainly look to upgrade your mask and have a better fitted mask. So that was a long...
Nope.
Regarding your second question was about pediatric vaccines. And I think that's what you asked is a really important question. And let me actually take a step back. And you know, in the beginning, I was talking about vaccines only currently being available for people 12 years of age and older. And the only vaccine that's currently available to be used in kids 12 to 17 is the Pfizer vaccine. That vaccine for 12 to 17-year-olds is the same formulation that adults get. But when we look at the vaccines being authorized for use in kids under 12, it's going to be a different form. It's going to be a different dose. In fact, Pfizer submitted their vaccine to the FDA for emergency use authorization. That's the technical term, EUA. And we expect there to be some approval, if you will, for use in kids 5 to 11 years old by the end of this month. And then after that, after it gets approval from the FDA, it has to be formally recommended by the CDC. And the CDC actually has a meeting of their Science Advisory Committee the very first week in November. So we expect that actually by the first week in November that vaccination using the Pfizer vaccine will open up for kids 5 to 11, but it's going to be a lower dose, which gets to your question about if you have a kid that's almost 12, do you get them vaccinated when they're 11 using the lower dose? It's a 10 microgram dose. Or do you wait until they turn 12 to get them vaccinated with the higher dose? I'm interested to see how this is recommended by the CDC when they come out with the formal recommendations, but my suggestion would be, my recommendation right now at least would be to get them whatever vaccine is the soonest available. So if they're 11 and they're not going to turn 12 for a month or 2 months or 3 months, get them vaccinated with the 11-year-old dose, the lower dose. And I say that for a few reasons. The studies, and we haven't seen a lot of data on vaccination in 5 to 11-year-olds, but when they compared antibody response with that lower dose in 5 to 11-year-olds, they had the same level of antibodies with that lower dose in 5 to 11-year-olds that adults had with the higher dose, right? So the antibody response is comparable. And in fact, when they looked at the antibody response in 12 to 17-year-olds using that higher dose and compared it to younger adults, the antibody response was actually substantially higher than in adults, if that makes sense. So if you're looking at the antibody response, the lower dose in 5 to 11-year-olds was very similar or comparable to the antibody response in adults with the higher dose, and that's part of the reason why we're looking at a lower dose for kids, if that makes sense. So my recommendation would be get them whatever vaccine is most immediately available. I think the vaccine, especially for 5 to 11-year-olds, school-age children, is going to be incredibly important to inform this discussion around how schools should operate during a pandemic. We're going to need to rely more and more on vaccination once vaccines open up.
Okay. Do we need to reset? Are we okay? Okay.
So just a little side note. I tend to ramble, so if I'm rambling too much, feel free to cut me off and divert me.
Okay.
Sorry, that was a really long answer to your two questions. But,
Thank you. That was
yeah.
very thorough.
Well, this might provoke another long response, and I'm not sure if you can keep it a short response, but I'll encourage you to try to do so.
Okay.
Early on with the whole vaccine process, at least in some of the faith communities, there was a resistance to the vaccine for various reasons. And some of them were, I won't categorize them. But one of the threads that happened for a lot of people was the whole development of the vaccine through fetal stem cell lines. For people in the church community, faith community, who have that concern, how would you answer them, especially if they're now looking at their kids? If they're nervous for their adults, now their kids are in the equation.
Yeah. I think it's a good question, and it's an important question, and you want a short answer. So my short answer is, from my perspective, there should not be a concern for somebody getting these vaccines. Now, I think to more directly answer the question about, like, well, what about use of fetal cell lines? There are, I think there were like fetal retinoblast cells that were obtained back in the 1950s, 1960s, that have since 1970s, that have since been cloned over and over again and used in research for drug development of all kinds. That's not unique to any particular vaccine. You may have seen media reports, for example, of over-the-counter medicines like Tylenol and acetaminophen and ibuprofen. Medical research in general has used these cell lines, cloned cell lines that have been grown and reproduced over and over again to do all sorts of medical research and medical development. There are no fetal cells in these vaccines. Now, where it gets, I think, a little confusing is that these fetal cell lines have been used, to my understanding, in the research and development of the mRNA vaccines, but were not used in the production of them, right? The J&J Janssen vaccine, so when I talk about the mRNA vaccines, I'm talking about the Pfizer vaccine and the Moderna vaccine. When I'm talking about, with the J&J or the Janssen or the Janssen vaccine, German pronunciation, I guess, it's a different type of vaccine. It's what we call an adenovirus vector vaccine, where they take a different virus, an adenovirus, to deliver the instructions to your cells to produce the proteins that then cause an antibody response. To grow that adenovirus vector, they had to use, I believe, some of these cell lines. And so there may be, if you look at the FDA package insert for the J&J Janssen vaccine, it talks about there potentially being like cell fragments from this line of cells that was used to grow the adenovirus vector in the production of the J&J Janssen vaccine. So, I understand the question, I understand the concerns, and oftentimes, if I can, I'm going to point to the Catholic Church here, because oftentimes the Catholic Church has the most strict stance on this, or the most has
Sure.
the more strict stance on this. The Catholic Church has said any of these vaccines are appropriate to be used, and that the fact that some of these cloned cell lines have been used in the development or even the production should not prohibit somebody from getting vaccinated.
Okay, so for the parent coming to this fall, maybe with that question, but just the question in general, should not have any concern either medically or ethically that the vaccine for the kid is okay?
I don't think so, no.
Okay.
And in fact, when we're talking about vaccines for kids, we're talking about right now the Pfizer vaccine, right? And the fetal cloned cells were not used in the production, my understanding is, of that vaccine or the Moderna vaccine. So I don't see this as being an ethical or moral issue for people to take the vaccine.
Okay, thanks. Anyone else?
That was the short answer that maybe that you were looking for instead of the long technical answer about how these vaccines are produced.
Somebody else?
Hi, Doctor. Thanks for coming out today. I believe I heard you say earlier that the goal might not necessarily be to eradicate this disease, but could you explain what are the goals, like on a state, community, state, and national level?
Yeah,
Thanks.
What are the goals of this pandemic? Right, so I said earlier, we're still in the pandemic. What are our goals? And I think part of your question is, what's the exit strategy, right? If COVID-19 is going to be around forever, are we going to be wearing masks forever? No, right? The goal is a de-escalation over time. I can't speak to what the exit strategy is, so to speak, at a federal level. In fact, these are conversations that state public health agencies are having with the CDC right now. What does an exit strategy look like? But I can speak from at least New Hampshire's perspective. A lot of this depends on vaccination, right? I think partly why we're being still very protective in what we recommend is because we still have a lot of people out there, a lot of kids who are not eligible to be vaccinated. And as I talked about earlier, that leads to then this question of, well, how do we protect our kids, right? And how do we protect people in our community who might not be kids but might be immunocompromised or have another health condition? And that leads to, I think, the continued need for people to take precautions. But our attention throughout this pandemic has shifted based on risk, right? Early in the pandemic, we were really focused heavily on the long-term care facility population. That's where we were seeing the outbreaks. That's where we're seeing the deaths. And once that population has gotten largely vaccinated, very high vaccination rates in that population, our focus has sort of gradually shifted to those populations that are not able to yet be vaccinated. And so I think the goal here is to get vaccine available to kids, get kids vaccinated, and then look at trying to pull back on these mitigation measures that we continue to recommend. So will we forever be recommending face masks in schools? No, I don't think so. I think we're recommending face masks in schools for everybody right now because vaccines haven't been available yet to many of the kids in school, and even in the older age groups where vaccines are available hasn't gotten a large uptake. I mean, at some point we're going to have to pull back on these mitigation measures and rely more and more on the vaccine, but that involves making the vaccine available and getting kids vaccinated. So I think what you're going to see is that by the beginning of November, vaccine is going to open up to 5 to 11-year-olds. We're going to work the following several months to get kids, as many kids in that age group, as vaccinated as possible, see where we are in the pandemic, and see if we can, start to get more back to normal in schools, and maybe even moving the direction of making masks optional and relying more and more on vaccination, if that makes sense.
Cool. Any other questions?
And that's part of the reason why we just keep coming back to vaccination. Get yourself vaccinated, get your kids vaccinated, because ultimately a lot depends on that. Sorry, just can't help myself.
Mine might be a little obvious. So I have a 7, 5, and 3-year-old. My 7 and 5-year-olds have asthma. And then this baby will be born right before the holidays, a week before Thanksgiving. So I'm just kind of personally looking for how hard of a line I need to draw between unvaccinated and vaccinated people. Like, who's ever had to decide, I can't share my baby with you?
For the holidays you're talking about.
Yeah. And in general, just like I have mostly vaccinated, but then one side is not. So I'm just trying to figure out, it makes for uncomfortable conversations, and I'm trying to figure out how many I have to have of how hard of a line do I draw for the protection of my baby and my 5 and 7-year-old, who hopefully will be vaccinated, but will she have, I know she'll have some of my antibodies, but just seeking some advice on that. And kind of following up on, you said, like, if most people are vaccinated in the room, but one isn't, is it still like a no-go situation? Just trying to sort that out.
So Amy,
Good luck.
Amy
Good luck.
wants you to go to her holiday gatherings with her.
You have those conversations for me.
Those are tough situations, and those are tough discussions to have, especially when it involves family and differing opinions and family, and some people are vaccinated, some aren't. So I'm not sure I have any concrete advice to give you. I think everybody has to decide what they're comfortable with. And keeping in mind the protection of your own family and your kids who are not yet vaccinated. And if you have a newborn, the fact that they won't yet be able to be vaccinated. Now, are kids at particularly high risk for being hospitalized and dying from COVID-19? No, we haven't had any deaths in New Hampshire, fingers crossed, thankfully, in kids under the age of 20, but there have been hospitalizations, and there's other consequences that need to be considered, like MISC, that's multi-system inflammatory syndrome in children. We've seen that this virus can elicit a very strong, when somebody's infected, a very strong immune response that causes multiple organ dysfunction, multi-system inflammatory syndrome, that can lead to severe illness and hospitalizations. We're hearing about long COVID or long-term symptoms, and so there certainly, even though kids may not be at high risk for being hospitalized and dying from COVID-19, there is still some amount of risk, and I think it comes down to what your acceptance of risk is for you and your kids, and what the exact situation is, and if there's different ways you can try and prevent or mitigate COVID-19, but still have a family gathering. I think there's a variety of ways to look at that, but at the end of the day, it comes down to, I think, what your individual and your family's acceptance of risk is. As I said, there's not going to be a situation in a family gathering where there's probably zero risk of COVID-19. What I will say, and this is a more firm recommendation, is that, and I think this is an important point to make, is that it is recommended that pregnant women get vaccinated. I think early on with the vaccine rollout, there was, still some there was a permissive stance for pregnant women being vaccinated without having much safety data. But as more and more pregnant women have gotten vaccinated, I think the benefits of vaccine during pregnancy clearly outweigh the risks. Pregnant women who get infected with the virus are at higher risk for themselves being hospitalized, having severe disease, and are at higher risk for adverse pregnancy outcomes, preterm birth, preeclampsia. Multiple studies showing that natural infection with the SARS-CoV-2 virus during pregnancy can lead to some pretty significant and severe outcomes, and the vaccines have been found to be safe during pregnancy. Vaccination during pregnancy also has the added benefit of passing on antibodies through the placenta to your newborn and through breastfeeding. So if you're vaccinated, you also protect your newborn.
Let me throw this one at sort of just a different topic. One of the comments I've heard over the last 18 months too, occasionally, again, I heard it today from somebody, again, in the faith community, church community, well, I choose to live by faith and not fear. Put both your hats on for a minute. How do you respond to that?
Yeah, so...
Because I wanted a good answer to give back to somebody too.
So this goes back to the question in the beginning, faith and science. They're not mutually exclusive, right? They're complementary to one another. So yes, have faith. Yes, trust the science and take steps to reasonably protect oneself and protect people around you. We're not saying live in fear. We're saying have faith and take steps that we know protect yourself and protect others. That's not living in fear. That's loving one another. That's living out your faith through action and taking steps to protect people around you. Again, even if you're not concerned about your own health, if you become infected, I think it's important to, and that this is, I think, the faith perspective, but also the public health perspective. Take steps to protect people around you.
Okay. Anybody else?
Yes, sir. First of all, Pastor, thank you for orchestrating this. Doctor, Mrs. I trust what you say because you're of our ilk. I have 4 honorable discharges behind me, and I saw a sign recently that said, I love my country, but I don't trust my government. I don't trust my government. So while I'm not challenging you, I'm asking you for help. The vaccination's good. The vaccination's bad. I had it, by the way. I didn't have COVID. I had vaccinations. The VA said I had to get them. I got. It's only good for 3 months. It hasn't been tested. You might grow a new head in 5 years. All these things that Fauci says this, Fauci then said. There is no trust to what these people put out. You're talking about pumping little kids with stuff. Who knows where this stuff comes from? It comes from Wuhan. It doesn't come from Pfizer. This one, that. My grandson had seizures after he got the MMR. So my daughter is not really thrilled about pumping my granddaughter and my grandson with this stuff, should it come about at 7 and 6. Where are we going with this stuff? What's the answer? This stuff hasn't been tested, but we're saying, pump everybody, get vaccinations. Now, I'm a father and a grandfather. I'm not a mother. These women are lions. They want to kill anybody that goes near their kids. They're worried about them. What do you say about that?
Yeah. Dan, thank you for asking that. I think that's a really important question. I had several different thoughts there. Let me collect my thoughts for a second.
Oh, this was rambling. What you did wasn't rambling. We're transplants from New York. We don't ever listen to anybody.
Oh, that's right. I was going to say. So trust, right? I think ultimately, and going back to sort of your original questions. Why don't people trust the science, right? And I think there's actually 2 answers to that. I think there's truly people that don't believe or don't trust the science, but I think there's another group, potentially a large proportion of people that might be hesitant to get vaccinated that actually don't know who to trust, right? Which is getting at your question. It's not that people may not trust the science, it's that they don't know who to trust. They're hearing varying messages out there. And trust is one of those things that is sort of built and earned. And one of the things that we go to great lengths for in public health in New Hampshire, and public health across the country, is to build that trust, right? And so I again, to your earlier question also, try and stay out of some of these really highly political, discussions that are going on at a national level. But we've tried to, over the course of this pandemic, earn the trust and build the trust for citizens in New Hampshire. And, we don't always intentionally, we don't always follow CDC recommendations. We review the science ourselves. We look at how to best apply that science, right? I mean, you can have science that's, one box of science that's applied in 2 different ways, right? So we review the science ourselves and we apply that science and make recommendations as we think are appropriate for the citizens of New Hampshire, and that's protective and safe for citizens of New Hampshire. And so I guess a couple responses to that. One is that absolutely understand the concern and the question around who do you trust, and if you don't trust the people at the national level that are speaking then look to your local public health agency. And I'm not saying that to say, listen to us, listen to me. We've tried to earn that trust over the course of this pandemic. We've tried to be out there speaking what we think is true and right and appropriate and protective for the citizens of New Hampshire. And we've tried to put out timely and accurate and reliable information. And that's been one of the difficult points of this pandemic, is that there's a lot of information out there. Some of it's true, some of it isn't. And people are confused. Who do you listen to? Who don't you listen to? What's true and what's not true? And so I think it comes down to finding somebody that you do trust that's putting out accurate, reliable information. And hopefully, my hope is that the public health agency in New Hampshire fills some of that void that's out there.
Well, now you're the guy.
Well, and honestly, that's a role. The public attention from this is not something that I think I or others have ever sought, but it's a role that I found myself having to step into for a variety of reasons. One of which is issues of having a trusted, credible, hopefully a trusted, credible source that people can listen to and get accurate information from.
So again, this wasn't one of those college courses, it's worth 2 credits, part-time.
This wasn't even a medical school course. This was a lot. Some of this was on-the-job training. Honestly, over years of addressing. Really, it's a lesson in communication.
But on one level too, there is that huge issue of trust that everybody has on some level. I go to my doctor because my leg hurts. My doctor says do this. I now have to have a level of trust that this person who has some expertise that I may not have may know what they're talking about. Now it's up to me whether I follow them or not. I said, I'm going to go find somebody else and get a second opinion. But I think one of the things we have seen in our country over the last 18 months has been, like you said, the erosion of trust in general for authority in general. And I think we talked about it in one of our conversations about the divisions that has brought to our country and now how that is now affecting public health.
And a breakdown in trust.
Yeah.
Right. And I think you bring up another important point is that, you're welcome not to trust public health in New Hampshire either, in which case we say, well, talk to your healthcare provider, somebody you have an ongoing relationship with, to talk through questions and concerns, particularly around vaccination. So it doesn't even necessarily have to be the federal government. It doesn't have to be New Hampshire Public Health. Hopefully you trust, or your family trusts, your local primary care provider or your local healthcare provider. And so a lot of times we also turn people back to have some of these conversations and express these concerns with their healthcare provider. But this is also part of the reason I'm here, is to, I think.
Trust comes with credibility.
Yeah.
You happen to be here. I don't see anybody else here. You know what I mean?
Yes.
There's a certain credibility by the pastor brings. So that's very comforting to me, and I'm sure most people here. What would your advice be for my daughter as far as this children who have had severe reactions to like MMR shots with this vaccine?
And so I think the second point you bring up is, are these vaccines safe for kids? And I think the answer is yes. We believe these vaccines are safe for kids, and partly, I think when it comes to vaccines, I think the U.S. does it right, to be frank and honest. The process that vaccines go through to be studied and then reviewed and then approved and then recommended is transparent, and the data is out there. And the decisions that are being made they're there, right? And we try to communicate this information from a public health perspective down to the public, to healthcare providers, to our school partners. But even if people aren't hearing those messages from us, the data is there, right? The scientific studies that are conducted to make sure that vaccines are not only effective but safe are published in the scientific literature. The science is reviewed by a scientific advisory committee at the FDA before a vaccine gets authorized or approved, what we call the VERB PAC, the Vaccine and Related Biological Product Advisory Committee, is a science advisory committee to the FDA that reviews the data and makes recommendations to the FDA on whether or not to adopt a vaccine in this case. That's all publicized. I think you can go online and watch those proceedings. After a vaccine is authorized to be used or approved to be used, it then has to go before the CDC and their advisory committee, the Advisory Committee on Immunization Practices, that again reviews the science to make medical recommendations for healthcare providers to follow in how to administer these vaccines. These proceedings are also, publicly available. You can go on YouTube and watch them. And in fact, when I have time, I do, because it helps me then feed the information down to our local healthcare providers. So it's a very transparent process. There's nothing hidden here. And you can go online and read exactly what's in these vaccines and the FDA documents on the CDC website. And so by the time the vaccine makes it to the healthcare provider that's putting the needle in the arm, it's gone through the appropriate studies and multiple review steps to make sure it's safe and effective. Regarding your particular situation where maybe there was a bad reaction, or I don't want to say a bad reaction, maybe there was like a fever reaction to another vaccine. I think you mentioned the MMR vaccine. The MMR vaccine is a very different vaccine from the COVID-19 vaccines. The MMR vaccine is a live virus vaccine. The COVID-19 vaccines are not live virus vaccines, and so the reactions are going to be different. But certainly there are side effects that can and should be expected after being vaccinated. Fever could be one of them, even with the COVID-19 vaccine, but these are usually mild, self-limited reactions, and it's a sign that the body's responding to the vaccine and developing antibodies and doing the work to protect oneself from COVID-19.
Yeah, and I think, are we doing okay time-wise? Okay. One of the things, go back to the trust too, is I encourage people in the church all the time to check me. I mean, it's a very biblical concept in the book of Acts. These Bereans were more noble because they searched the scriptures daily to see if these things were so. So if I'm teaching something, I challenge people, search scripture. Go find the facts yourself, the entirety, not just like one verse here or there, but search the entirety of the scripture, find out the facts for yourself. And I think that's one of the things in terms of trust these days too, that it's been easy not to do that. It's easier to take a sound bite and trust the soundbite rather than doing the hard work of the next step of where did that come from, what's the source, how valid is the source, how credible is the source, and doing that hard work. Yep. And I think partly is because so much information coming out, people are a little tired and people just want a quick answer. And here's a quick answer I can hold on to rather than the discipline of working through it themselves.
I think that's a great point. People need to assess and be discerning about the source of where they're getting information from.
Yeah. Other questions? We're wrapping up in about 10 minutes.
Thanks again for coming, Dr. Chan. I have heard some people saying now and again, and I don't personally believe this, but I was wondering if I could have your professional opinion, that they're concerned about using the vaccine because it would create selective pressure if you for developing certain variants. I'm inclined to think it would be the opposite, but I was wondering if I could have your opinion on that.
Yeah, great question. So variants develop because of genetic changes to the virus, in this case the SARS-CoV-2 or the COVID-19 virus. So the more that a virus is allowed to spread and replicate within a person and then spread between people and replicate in another person, the greater the opportunity that virus has to change. And we expect this virus and other viruses, in fact, to change over time, and I think we're seeing that play out. And I think to your last comment, that's exactly the reason to be vaccinated is to prevent infection, to prevent the virus from infecting people, and to prevent the high levels of transmission and replication that would lead to genetic changes. So I would agree with you that I think actually vaccination, and you've heard this commented on also at a global level about the need to make sure that we vaccinate, take steps to vaccinate the global population, is because if you allow the virus to spread and replicate in another continent, at some point it's going to mutate, it's going to change genetically, and then that virus is going to make its way to other parts of the world. And so the way to prevent that is to vaccinate as many people as possible. So vaccination is actually a tool to prevent that from happening.
Okay, lightning round question. We're coming into flu season, and you're talking about that viruses mutating. Just comment quickly on how every year we hear a new strain of the flu, new vaccine for the flu, how that progresses and how that compares to how the SARS virus is changing and mutating and the need for vaccines. So.
Yeah. So each virus is different, right? The influenza virus is different from the coronaviruses, different from COVID-19. But the influenza virus is one example also of where, as the virus spreads, it can undergo what we call antigenic drift. That's a sort of a technical term where the proteins on the surface of the virus can change over time. And that's part of the reason that a flu shot is needed on an annual basis, is because the virus has changed, people's immunity has waned or decreased after influenza vaccination, so there's a need for a booster. Now that's specific to the flu virus, and it's specific to the flu vaccine. COVID-19 is different. The COVID-19 vaccines are different. Whether there may need to be something like an annual booster to the COVID-19 virus, I think still remains to be seen. But we are moving in the direction of, after somebody gets, their first 2 doses of Pfizer and Moderna, we're moving the direction of at least, recommending another booster after that because of the new Delta variant that's circulating, because of the potential for decreasing immunity. But whether additional boosters may be needed after that still remains to be seen.
Okay. We're sort of at the end of our time here. Boy, I hate to ask any more questions, but
Go for it.
But no. Just I want to be diligent for our time too. But in our setting again, and where we are, and what all that we've been talking about, any last words of encouragement or any last words of advice to, just people in general, but also people in the church community about how to make sense of all this and how to proceed?
Yeah, first I want to thank you all for coming and asking your questions. Hopefully, again, I tend to ramble sometimes, but hopefully that it was informative and gave you the opportunity to ask questions. I think that there's a lot of, excuse me, I think the question that was asked earlier is sort of central in many people's minds. When is this all going to be over? Like, how long are we going to be talking about coronavirus and vaccinations and masks? And it's been a long and frustrating process, but I think there is reason to have hope, and I think that involves having these kind of discussions, understanding one another, and frankly, understanding the need, I think, to not only protect oneself, but also protect other people against the virus, and that once vaccines become available and open up, particularly to kids, there will be more move to try and transition to something that's a little bit more in the realm of normal life, so that we're not all sitting around looking at each other, wearing face masks. But I think these are important discussions to have. There's real valid questions and concerns that are out there, and want to make myself, available to try and address some of those questions and concerns, have these sort of more difficult discussions potentially, to hopefully build that trust and the credibility so that people can have an accurate, reliable source of information.
Well, thank you. And I'll throw my pastor hat on again just for a minute. Again, no matter how you feel about this, even the questions you may still have or wrestling with all this, for me, one of the band-aids that comes out all the way through Scripture, and I was just talking about this the other day, the question early on in Genesis with Cain and Abel, when Cain has murdered his brother Abel, and God comes to Cain, and Cain says, "Am I my brother's keeper?" And the silence from God in not answering Cain, because the answer should have been so obvious to him, yes, you are. Yes, you are. And for us as Christians especially, our call is to watch out for one another. And wherever we wind up coming down on this whole thing, in terms of our own personal decisions, the idea about what can I do to help somebody else? What can I do to protect somebody else? What can I do looking out for somebody else's benefit, even if it's an inconvenience for me? I think is a biblical concept that is really hard to argue with. And in a culture right now which is so divided, may we be people who are healers as we put our faith into practice, going the extra mile, looking out for one another in such a way that the world around us looks at us and say, I don't understand why they're doing that. I don't see that anywhere else, and I want to know more. And that's my challenge for me personally as we continue to walk through this, because, like you said, we're still, I'm not sure whether in the 6th, 7th, 8th inning. If it's a Red Sox game, it could be the bottom of the 9th inning, it's still not over. We still have an opportunity to be people who not only think with our minds, but also believe in our hearts, and the two are not mutually exclusive. So.
And I'll also, I should have said this at the beginning, and I sort of intended to, but it may be apparent that I'm much more comfortable speaking to science in this kind of setting than I am to issues of faith. And I think partly I don't want to come across as sort of being some authority on someone's, and I think I said this to you in some of our conversations before this, I don't want to come across as speaking from some kind of moral high ground or, lecturing people on faith. I just know that from my own perspective, what motivates me in my job to protect the health of people and the well-being of people in our community really, even from the early days of education up through now, really is motivated by faith and a desire to look out and protect people. And I think it's frustrating when I don't see or perceive other people doing that, but I think have tried to increasingly over this pandemic sort of highlight the need for all of us to step into that role, whether it's motivated by faith or not, step into that role of protecting people in our community. In this case, we're talking about from COVID-19, but really out of love, needing to look out for the health and well-being of one another.
Great. Well, again, thank you for being all that you're doing, all your staff's doing. Thank you for being a part of this evening. And please don't take this the wrong way. I'm looking forward to the day where I don't have to see you on TV.
Likewise. I don't see myself on TV.
But really, I appreciate the time and all. And at the end of this broadcast, we'll put some websites on you can go to for more information for the Department of Health and Human Services, for just other information and questions. I'll put my email on in case you want to have any questions you want to direct to me, one way or the other. And let's just sort of keep the conversation going for the benefit of all as we move forward. So, again, thank you.
Thank you. My pleasure. Thanks for coming.